the fear of surgery is, I think, a legit fear. And it's only when there's no choice, like you've broken a bone and it's bleeding. Correct. I guess there's no choice, so people don't ask. But it's when it's a quality of life operation rather than a life or limb saving operation, the entire discussion has to be made.
Hello, friends. Welcome to today's episode on how to take surgical decisions. We have with us Dr. Abhay Nene, an eminent spine surgeon from Mumbai who has been a surgeon for the last 25 years. He will walk us through what information should we know before taking a decision on surgery. Thank you, Dr. Nene, for taking out the time to be a part of the series called Decision Making in Healthcare. What do you think? Are healthcare decisions simple or complex?
They're clearly very complex because healthcare not only works around what disease you have, but which place you come from, what is the ecosystem around you, and what are the kind of healthcare facilities that are offered to you, and what's your pay package. So it becomes a complicated social come economical problem to deal with.
Well, I mean, those are the peripheries of taking a decision. But when it comes to treatment decisions, do patients wholly rely on the provider, or do you see more of them actively being involved in, trying to decipher which decision is best for them?
So this is the complicated questions with a long answer. But I must say that in a good way, they don't wholly rely on the healthcare provider. That's in a good way. So they today's patient, the discerning patient, will take all the information from the healthcare provider and he will sort it in his head, he or she, and will manipulate it in a way that fits his school of thinking. And if he's still not convinced, he will not hesitate to take a second opinion, which I think is a very healthy sign because many of the ailments that we treat today have multiple ways of dealing with the problem. It's not one plus one equal to two all the time. So in a healthy way, this goes around in a few circles before it lands at its optimum destination, and I think that's how it should be.
Does a shared opinion take the responsibility of decision making? It doesn't become lesser from your head and it becomes more of.
Most certainly, I think in a good way. Typically, I would tell the patients the available choices, but ask him to choose because I've given him the pros and cons. Look, I know the person with the disease. I don't know the person actually. I just know the disease. So, I'm a spine specialist. Someone comes to me with a disc prolapse. There is an option of waiting it out for a few months and things can get better. But I don't know how he thinks, what his personality profile is, what his risk taking capacity is, what his job profile is, how soon he needs to be on his feet. So once I put forth the pros and cons of a quick surgery and a quick return to work versus a prolonged conservative treatment, it is he who has to decide where he fits in. And really, it's not my call. You see, so I'm much happier for him to be involved in this decision making. And yes, it goes off my list then.
But are there situations where you would take a decision and not leave it to the patient?
Of course. There are clearly conditions where we tell the patient that, look, this has no other choice. For example, again, in my field, if someone's losing neurology, getting paraplegic, or if the common parlance, someone gets a heart attack, there's no negotiation happening in the casualty. The person is wheeled in and the treatment is done. So there are situations where we overrule any further discussions. Of course, we, again, being in 2024, discuss in detail why we are overruling, what's the reason.
Right.
And you would almost never find a patient or his relative challenging that. So once it comes in an authoritative manner, you take the decision, and I think there is no discussions there. Most of these, mind you, are universal, which means that most of these situations where we do not entertain a choice from the patient, I think across the globe, no doctor would think
You're not going
differently.
to get conflicting opinions.
They will not be conflicted.
Okay, so
These are quite die-hard, cut and dry situations.
And what if a person is not given a choice in orthopedics? Is that something they should be okay with? Like, I mean, let's say it's not a trauma case. It's not a case where the only treatment choice is surgery. But then, let's say they walk into a doctor's office and the only treatment option that they have been given is a surgical decision. Should they be questioning that? Should they be asking for opinions? And how do we know that I need to explore further?
So today, I don't think it's all right for you to walk into a clinic and be told that you need XYZ treatment and you just suck it up. I think it's completely legit to ask the doctor, sir, what are my options? what are the pros and cons of my options? Are there any options at all? And then finally, respectfully, what would you suggest that I do and why?
What is the most commonly asked question when people want to take a surgical decision? Like, is there a question that is standard across demographics?
Across the Indian demographies, can I avoid this surgery?
Why
Poor
is it
things.
scared of
Poor things. I mean, they would be. I mean, I put myself in their position, and of course, if there was some chance that I could avoid an operation, I would want to ask my doctor. And I must again give you an insider story that as surgeons, our personality is a bit biased towards quick results, towards faster results, and maybe towards slightly cutting edge, better results. And typically, cases where surgery and no surgery both can be pitched against each other. So cases which are 50-50 or 49-51, surgery always gives a faster result. Surgery always gives a more definitive and a more controlled result.
Do you always give better results?
Typically, they do give better results because you're off the blocks faster. So rehab gets much better. But you have to pitch this against the fear of the surgery in your head. You know how much you're going to break your head to get this operation done as a patient. And very often, so my tagline is this, that you're uncomfortable. But if you're more afraid than you're uncomfortable, then probably you suck up the discomfort and we'll treat you conservatively. I mean, because the fear of surgery, though it's significantly changed over the last 10 years compared to what it was in the early 2000s, the fear of surgery is, I think, a legit fear. And it's only when there's no choice, like you've broken a bone and it's bleeding.
Correct.
I guess there's no choice, so people don't ask. But it's when it's a quality of life operation rather than a life or limb saving operation, the entire discussion has to be made.
Has to be made, and the treatment choices have to be given. I've interacted with you so many times, and you say that it's not necessary that surgery can always give better outcomes. You say conservatively, we can also get there. And sometimes you push that to a patient that take the conservative route instead of the
Rashi, we've begun to recognize people who would rather not have the operation. We know that conservative care, works in 9 out of 10 people. Only 10% actually end up needing surgery. So this person who falls into that bracket, I will lean on him for conservative treatment. But at the end, I will not let him go without giving him the surgical option or the injection option, because ultimately I have made my mind looking at him, but I really don't know him. So it'll be disservice if I didn't disclose the surgical option. Sometimes they may surprise you. They may say that, look, I'm looking for a quick solution. I'm into sports, I'm into yoga, I'm into physical fitness. I cannot stay out of it. I mean, I'm putting myself in that line.
Correct.
And if I was asked to put a plaster and sit at home for 3 months versus do a surgery and get back to work in a week, I would probably choose the latter. So it's good not to make decisions based on your ideology of the patient or your interpretation of his characteristics, but put the options out.
With the general IQ going higher, people also shop around. Like we already you touched this topic a little bit that people do. There are more specialists available. They go to many more people, and they have opinions, and they're sitting on different approaches. How healthy is that? I mean, are there two sides to?
In its pure native form, like I said before, it is healthy. Like if everything is clean and nice, it's healthy because you would want to look at 3 shops before you buy something expensive. You want to, if you're buying a Porsche, you obviously looking into Ferraris so when you're putting in, I'm not talking purely monetarily, I'm saying the effort and the sentiment that goes into a surgery. When you're pitching that, it's good if you can see multiple options and multiple physicians or surgeons. I mean, not even surgery. This is even just a diagnosis, like an interstitial lung disease. Do I need this medicine or should I take steroids or should I be on the BiPAP? These are again big decisions for an individual. So it's good if that person can see more specialists. The slight, twist that comes in here is gift of gab. So some of us speak much better than other people and can sell themselves better. And sometimes that can hoodwink the patient. And I guess there's no solution there. And cheers to the guy who speaks well. He sells his goods better. And then a bit of, it's a wrong word to use on the public forum, but advertising. How a particular surgeon or a physician has been advertised in the social media or the society, or if there's a big write-up about him in the Times of India, he comes with a far more weightage, which need not necessarily be true. Again, he's a good man, but his opinion gets valued more.
So, I mean, in the interest of patient, when they walk into any doctor's chamber, just like you said that there could be people with the gift of gab and they could sell the service better. How would you train a patient to choose the right treatment, the technique, or any other decision related to their particular surgery or treatment? Like, what would you ask them to find out, and what should they leave the consultation room with?
So, how much ever you sugarcoat it, our surgeon's philosophy, and you'll hear other surgeons saying this, dane dane pe likha hai अच्छा है खाने वाले का नाम, means ultimately the patient will choose the surgeon who he feels the connect with. He will not. So, typically, choose your surgeon and let him choose the technology and the hospital and the technique rather than you saying, you please do this technology in that hospital. If you leave it to the surgeon, you do it because you've trusted him. Trust him to take the best care of you, and leave the rest to him, and he will take care of you. How to choose the correct surgeon becomes a multimodal decision. But like I said before, the Hindi proverb, it eventually goes to your contact and your connect. It's like how do you marry a person? It's so hard to make those decisions, but you have that connect, and you normally just say yes to that surgeon. And I'm actually encouraging you to meet me 2 or 3 times before you say yes to me for surgery. Because you know this guy, you know his results, you know his background, and of course you know his academic stature. So when you look at more and more variables, the chance of you going wrong becomes less. If you just walk in and say, well, what a swanky clinic, I think I want him to be my surgeon, you can have it completely wrong. But I think, like I said, today's discerning patients has multiple inputs before he actually decides. And I'm going to say that he often doesn't get it wrong, because if you see across the board, most surgeons or most physicians who have a high reputation, high patient turnover, high inflow are good doctors. You rarely will today, 2024, find a average or a mediocre doctor having a fantastic practice merely because of his selling skills.
You mentioned it is more important for us to pick the right surgeon, the right doctor, more than deciding which technique is better, which treatment versus better. But that is very difficult. Can you give us a little sense on, how do you choose a surgeon?
If there was the age-old, well-respected family physician, he could have been a great asset. But today, that specialty is diluting significantly for the obvious reasons. So it comes to then direct access to a specialist. I think someone who's a subspecialist, someone who does that particular job exclusively for the problem that you've got would probably be the right person to go to. If not, someone who does a heavy number of that work, because see, ultimately surgeons per se are hand skilled people. We actually don't even consider ourselves doctors. Like in UK, they're called Mister, because your technicians and your job is hand-eye skills. So of course, the more you do, the better you are. Car mechanic who fixes cars, gets better with each car he fixes. So I think the numbers, the turnover time, the team, what sort of a team he leads, what is the level of the people. Are you working with unqualified people assisting you in the OR, or do you have some super qualified people? What sort of hospitals you're working in? Because hospitals also pick and choose their services. They don't allow all and sundry to come in. And of course, then your qualification, then your academic setting, and ultimately, how you match up with this person and what reputation your near and dear ones have given you for that. So I think that would be the pyramid where you start deciding who's going to be the guy at the apex.
What do you think? Where does India stand when it comes to international care? I mean, since you said that you are a part of that body.
Yeah, no. I think healthcare in India, thankfully, or we should be proud, is probably, I'm going to say, the best in the world. I might sound conceited, but I'll tell you why I say that. Because we have the most skilled doctors because of the sheer numbers we work with when we train. So our experience is massive by the time we are put in the field.
Mm-hmm.
We have great hand skills for the same reason. We have the ability to work under duress. So we are working in circumstances with less equipment, substandard if you may call it, and yet we get the results. Our patients are extremely stingy in terms of reoperations, etc. So we have to give that result under high pressure. We work under economic constraints, so we can't be randomly spending money to get those, frills and fancies in surgery. So and we have great hospitals. We have all the technology that is really needed. There's some technology that may not be needed, and we may not have it. And more importantly, from a patient's perspective, the patient has direct access to you. If you have an abscess, you see the doctor and he drains it. If you have a cancer, you see the doctor and he treats it. There's no waiting list. You don't have to apply to someone and then wait for 6 months in some countries for an MRI scan and then 6 months more to see the doctor. We have direct access, and the cost of healthcare is amongst the lowest in India. So on all fronts, I think we are sitting right at the top of the heap.
Any particular odd request in your career that has come to you and you've had to, like, just on a lighter note, you've had to accede to it, or you've just.
I mean, typically it is this that my Jyotish said that, I want you to operate on Sunday evening at 6 p.m. Then, in a lighter way, I say, but my Jyotish said that the best result is if I operate you, on Friday morning. So, whose Jyotish would you trust? And then suddenly their eyes light up and then they kind of are on the same page. But overall, I think, Indians are a great bunch. We all, you and me. And its life is full of adventure, and there's never a dull moment in your clinic.
Well, this was extremely insightful. I'm sure all our viewers have had good, that now they have good information on how to decide and what to ask their surgeons to take a decision when it comes to which technique, when, and which surgeon to choose. Why don't you speak about something like, are surgeries better handled by women? Do they take better decisions? What is their approach towards?
To appease the audience, I'll say women power is the best power, but in reality, it's a 50-50. Because they're people, they're not women and men. Different people make decisions differently, and women are empowered in a different way. So, in no way are they the weaker sex, and I would always want a female patient to make her own decision and a male patient. The husband can't take a decision for the wife, but it's not better or worse. But I think in terms of ailments, I must add here as an orthopedic surgeon at the base that females run a higher risk of orthopedic ailments because of multiple factors. I mean, the weaker sex in terms of physical strength, but menopause leading to osteoporosis, a lot of musculoskeletal disorders are passed on genetically from female to female. Sarcopenia happens in women, and overall, in a country like ours, the propensity to exercise in youth or play outdoor games until now was skewed much heavily in favor of men, and that's what actually sows the seeds of your skeletal health in older age. So the message out there would be that be physically active, don't be shy, hit the gym, and today in my gym there are more women than men. That's good to know. And remember that you're going to have a steep fall in your musculoskeletal health at menopause, and prepare for this in advance. So, invest in your muscles and your bones in your 20s and 30s to reap the benefits later. And even later, deal with menopause in the right way by exercising, remember your muscles are only strength. So your bones will degenerate, your joints will degenerate, nerves, skin, hair, but muscles are the only tissues that can respond and that can actually regenerate, in a flagging and in an older age. So just spend time out there on your fitness. Don't consider obesity or overweight as a natural, process after pregnancy. Turn things around and be at the pink of your health. So, you will not be the proverbial weaker sex.
Okay, well, that was extremely helpful, insightful. I think those are the tips that we need to follow so that we don't meet Sir in the surgical room, and maybe outside somewhere we can be running or doing other activities together. And with that, I would encourage you to leave feedback, any questions, any comments for Dr. Abhay Nene, such that we can take better decisions when it comes to our healthcare. Thank you.